With us this morning, the man who will be in charge of the vaccination rollout program itself, Dr. Achianu of the Ghana Health Service. And from the West Africa College and the University of Ghana, Dr. Yao Bidiako, who is an immunologist as well. Let's acknowledge him with a round of applause. And please let me start by asking the Honorable Minister to formally open, the Honorable Minister designate to formally open this morning's engagement with a welcome address. Minister.
Thank you very much, colleague, Minister for Information designate. Gentlemen and ladies from professional associations and research institutions and for the media and citizens of our nation. We are in a place where none of us thought we will be when it comes with COVID. We did so well initially last year around March. We started seeing the first cases, and around June, July, it was like we were going helter-skelter, fighting what had afflicted us. A lot of things were done. Different stakeholder engagements, the president calling all of us, different associations, stakeholder engagement, what we could all do together to fight the battle. Protocols were developed, several of them, at the workplace, in the markets, everywhere. Basic things like social distancing, hygiene, hand washing, all these protocols. Even in our trotros and buses, we started doing social distancing, to the point that we have to close down some parts of the country. Churches were closed down. We even sacrificed our Easter. Then we did so well, the world acclaimed us. And this is not the time for me to apportion any blame. Unfortunately, we are back to what they call second wave, and our numbers and the severity of the illness is a bit different from what we saw last year, and even around July, August, when we were peaked. Presently, we don't seem to have any new thing that we are going to do. Luckily for us, let me appreciate that the type of things we started stopping to do, the wearing of face masks, the hand washing, the sanitizing, and all those things, people are now getting back to these protocols now. And I will encourage all of us that it is paramount, very urgent, that we all get ourselves to adhere to the protocols that we developed and worked with. The only new thing we are going to add is the prevention mechanism, which is the vaccination. The world had rushed through to develop vaccines, which is quite unusual because the scientists wouldn't accept how many days vaccine development to roll out. But because of the urgency and the emergency situation and the pandemic that is afflicting the whole world, they've managed to get us something to use. WHO will always tell you that for universal health coverage, no one should be left behind. And therefore, Ghana will not be left behind. A lot of things have been done. We've had stakeholder engagements with a lot of groups, and we're continuing to try to see how all of us Ghanaians will buy into the vaccination program. So this morning, I'm glad I'm here with my colleague, Koyo, and Director General, Ghana Health Service, with his team. Luckily for us, we have a very robust immunization program within Ghana Health Service that is part of the health sector. So we have some structure that is already situated to facilitate the type of thing that we are going to do. I wouldn't want to go much into what they have done to showcase this morning to all of us. But all I will say is that this is for prevention, so that you don't get infected, so that even when you get infected, the severity of your illness will not be as anything. Vaccination is not a new thing in the world. Those of us who are a bit elderly, when we were young, if you pick about 10 young people, you will see some scars on their left here. Those days, vaccines, they were not even using syringes as easy as it is now. They were using some knives. No, before the gun. You are young. You are young. Then they will put it in the candlelight. That was for sterilization. And then they will prick you here. That is what they were doing before the gun came. You know, and my daughter saw the gun, and we're in Nigeria, and somebody somewhere in Sokoto even scratched with the gun. I think she was struggling, and it just came down, so there's a mark there. So we have had vaccines so many years back. At least I'm close to 70. So 70 years ago, we were doing vaccines. Luckily in Ghana, we have success stories to tell with vaccines in children. Measles, polio, tetanus, all those things. We have used vaccines to try to prevent our kids getting them, right? So now, vaccines shouldn't be a new thing for us. And that is where we are. The only new thing we are going to add on to the battle that we have fought since last year is the vaccines. And if you are able to go around the country and vaccinate almost everybody, we believe our problem with COVID will begin to go down and down and down. So I wouldn't talk much. I would thank you very much for your audience, attending to our call. Once again, we have partnered you since last year, and we continue to join you, or you join us, in strategic partnership, the way I can describe it, to fight the battle together. I thank you so much.
Thank you, Honorable Minister-Designate, for your opening remarks. Colleagues, as I mentioned, very shortly I'll be inviting Dr. Yabedi-Akon, who is an immunologist. He's with the West Africa Center for Cell Biology of Infectious Pathogens at the University of Ghana. And he will do a brief presentation to us on the essence of immunization and vaccination in general before we go specifically into the COVID-19 vaccination rollout program as well. That presentation will be made by Dr. Kwame Amponsa-Chiano, who is the Program Manager, Expanded Program on Immunization at the Ghana Health Service. I want to quickly acknowledge some of the various groups that are here with us. The Ghana Health Service itself is here with us. The Ghana Registered Nurses and Midwives Association is here with us. Coalition of NGOs in Health, they are here with us. Noguchi Medical Director, Dr. William Ampofo, I understand, is here with us. I think the Pharmaceutical Society of Ghana is here with us. The Ghana Medical Association is here with us. The Regional Health Directors are joining us via Zoom. The Food and Drugs Authority and the Ghana Standards Authority are also joining us via Zoom. We have with us here lots of our colleagues from the media. But just before we start, I want to invite Dr. Patrick Kumar-Boaje to give us a quick update on our COVID situation as at this morning before we get into some of these specifics. So, Doc, if you turn on your microphone from there, yes, and tell us about it.
Thank you very much, Honorable Minister. Honorable Minister Designate for Health and Information, colleagues from the Health Service, our partners, I will just give a very short brief of our status so that we can go on with the reason why we are here. We will talk about a summary of the cases, what have been the events, our testing, tracking situation at the KIA, that's in terms of our mask use. What is the justification for vaccination? As the Minister has highlighted, I'll get a few minutes. And then also, now that I have opportunity, I'll give you an update on the Ebola situation briefly. We are currently averaging about 500 to 750 cases per day. Our active cases, I would say, is not increasing, but it's high at a stagnant position with a slow declaration. All regions are reporting cases. The cases at the Kotaga International Airport has continued to decline significantly. And then there's evidence that poor face mask in the evening and the night is a problem for us. And currently, 14 regions have reported sporadic cases of COVID-19 in the schools. So in summary, as at the 6th of February, which is the current report, we have detected 17,165 cases from 858,000 tests with a cumulative positivity rate of 9.2%. We have discharged 71,000 plus. We are currently recording 568 deaths, bringing our case fatality rate from 0.7 to 0.72, a rise from 0.6 that we've been recording. The majority of the active cases, about 53% of them are in Greater Accra, specifically the Accra Metro and its environs. Ashanti is recording accounting for about 12%, with Western third with 6.2%. All regions, as I said, have reported cases, and all regions have active cases now. But for this reporting time, four regions did not report any new case. As the minister mentioned, way back in March, March 2020, that's when we saw our first case. There have been drastic measures that have been put in place, including ban on international flights at one stage, a lockdown, partial lockdown in Accra and Kumasi, enhanced contact tracing, have an aggressive testing resulting in high numbers of cases in May, June, and August. We had a decline coinciding with the high rate of the face mask use reduction, and reduction adherence to the protocols. So it has been a very good pattern that we've all noticed. On the case management, as at today, we have 273 cases on admission, a total of 29 critical cases, 89 are severe, and 155 are mild to moderate. As you can see, this is a decline compared to what we had a week or two ago. But to see that the average, the 7-day moving average, because of the way our testing is done, the moving average gives us a more accurate results. You can see that it's risen, but we seem to be tapering at a point, and we hope that with adherence to protocol, we start seeing further decline. This just to show us the epic curve that we've had. You can see that the curve seems to have, I don't want to use a word that people don't want to hear, it seems to have plateaued, and we are hoping that with the adherence to the protocols, the curve will start coming down, as we saw in the very first one. And I think that depends on what we do. You can see that our active cases rose to the highest point we've never reached before, over 8,000. But in the last week or two, that adherence to protocol, the use of masks increased. We have seen a plateauing and now a decline. If we continue, we can see further decline. Today, we are reporting a decline in our active cases. But if we continue, we're going to have the same decline go down. But as it is, it's still at a very high point. We never reached 7,000 before. The evidence in the KIA, that's the Kotoka International Airport, you can see that we are in the middle of the third week of February, we have recorded 59 cases compared to 480 in January. That shows that the airport, the cases are declining. And you can see from the chart that the daily cases are also declining, as it shows. How are we doing with our face mask wearing? We've seen some, the next, we focus on Greater Accra, even though we have, the regions have their own use, but it's lower than the Accra. But we focus on Accra because Accra is the seat of the before we harvest all the viruses. We have moved from 47 to our 52% accurate when in the morning. It drops to 41 in the afternoon, and the evening it becomes 26. I don't know whether it's a new group or people get tired and remove their mask, but I think that we must know that the virus doesn't sleep, and so we have to wear our mask all the time. You can see that in the evening, the number who are not wearing masks goes all the way to 57%. And so that's another area that with media, we must also remind people. So far, we have, since school reopened the middle of January, we have recorded 556 cases across the region from 139 schools. And so far, there are about 2 regions that has not reported any case in their school. That is Northeast and Savannah. They've not been any reported case of positivity from the schools so far. So that gives us a brief of where we really are. But just to add a few words to what the minister said, our move towards vaccination. We have implemented public health measures across the country since the detection of the 2 cases. And I mentioned enhanced tracing, tracking, risk communication activities. We put in place restrictions to ban large gatherings, etc. It is time to focus on our individual bodies, which is the vaccine comes in, to train and prepare our bodies' natural defenses. That's the immune system to recognize and fight off the virus. And I think that's going to be another phase. That's where we really are. And I must add, and I'm sure Dr. Bedia can give us more elaboration, that vaccination is safe, effective, and to prevent a lot. Currently, vaccination protects us from about 20 diseases, and WHO records show that it saves 3 million lives every year. And so this is something that we've always done. But why do we need a vaccine? We need a vaccine because it's effective, and it has been used in various cases in the country. Now that our borders are closed, etc., this gives us the best opportunity to vaccinate the people of Ghana. We have also, there's less and optimal use of the protocols. People are not using the protocols, so it cannot be the panacea. It's a good panacea, but it also goes to add that because of the low face mask use, vaccination coming at this time will be very, very helpful. We have continual community transmissions, and so we cannot take those things for granted. And all regions have reported cases. So our outlook is that our response to adoption of, we got some responses through our outbreak through adoption of several measures. Some of the gains, as I mentioned, have been eroded by the non-adherence to protocols, and there's a need to break the transmission with using vaccine and the other protocols that we continue to share. So that's it for us. So that I plead with you that it's not the vaccine is not the end all, but it's supposed to be in addition to the things we're already doing. Now that I have the opportunity, Honorable Minister, let me just talk a bit about the Ebola disease that has been declared in Guinea. This was a WHO report outbreak, that reporting the outbreak. It has reported that we have Ebola virus disease in Guinea on the 14th of February in the town, I don't know whether I can remember, in Zerekore, in the second largest city in the southeastern Guinea. As of 15th of February, 10 cases of Ebola have been found, all adults over 40 years, 3 laboratory confirmed, 4 probable cases, and 3 are pending results from the laboratory. Among the cases, there are 5 deaths, of which 1 is confirmed, and 4 are probable deaths from Ebola. This city lies at the intersection of the road from Ganta, that's in Liberia, the Nile in Cote d'Ivoire, and therefore the likelihood of the transportation to the neighboring countries is very, very rare because of where location is, and so we all need to beware. That is why we have released the alert that somebody ingeniously has removed a Guinea and put Ghana. There's no case in Ghana. So we issue alert for the regions to be on the lookout and activate all the public health emergency systems to include Ebola, because that's the same system that's fighting the COVID. We also public education on Ebola using the media and other platforms is to be enhanced at all the regions, and that we also have included that is part of the emergency management committee meetings, which happens in all districts of the country, with the DCs among others. We have sent notices to all regions about this, and so this is just the brief. So yes, there's an outbreak in Guinea. It's not yet in Côte d'Ivoire, and it's not in Ghana, but we need to worry. Thank you very much, Honorable Minister.
Thank you, Dr. Waje. But if COVID could move from wherever it was because of human travels, then we can't necessarily go to bed thinking that it is so far from us. So the preventive measures that you speak about are the ones that we have to adhere to. As I mentioned, we'll get into Ghana's COVID-19 vaccination rollout program itself. But just before we do that, I want to invite Dr. Yao Bediakun, who himself is an immunologist, to quickly speak to us about the whole concept of immunology and vaccinations and what it does or has done for us so far. How safe is it? How effective is it? Please, if you join us at the podium here, we'll project your presentation. He is with the West Africa Center for Cell Biology of Infectious Pathogens at the University of Ghana. That's a big name.
All right, thank you very much, Honorable Minister Designate, for information, and also Honorable Minister Designate for Health, the Director General of the Ghana Health Service, and all the officials from the Ghana Health Service, from other healthcare facility providers in Ghana, my fellow academic colleagues, members of the media, and everybody gathered here for this important briefing. So as the Honorable Minister has mentioned, my name is Dr. Yao Bediakun. I'm from WACBIP. Since our name is so big, we just go by WACBIP. But our center at the University of Ghana focused on understanding disease in many ways, many infectious diseases. And I'm very honored to have been asked to provide this brief overview of vaccination and vaccines, because it's really important that us as citizens of this country really understand what a vaccine is and why it is important that vaccines are rolled out as quickly as possible. So the outline of my talk will be a brief introduction to the history of vaccination. The Honorable Minister of Health has actually already stolen some of my thunder by talking about variolation. We'll talk about what a vaccine is, how is a vaccine developed, so more generally, and then talk a little bit about the types of COVID-19 vaccines that are currently available, and then a brief update on the progress of COVID-19 rollout across the world. Ghana is not the only country to be rolling out vaccines. So this figure basically just shows you a timeline of vaccination over history. It's really The idea of preventing disease started somewhere in the year 1000 AD in China. And then in Europe, the idea of variolation, which was exposing people to a little bit, typically for smallpox, a little bit of infection, was done as early as 1721. The first vaccine, however, was administered in 1796 by a gentleman called Edward Jenner in the United Kingdom. And that is actually where we get the name vaccine from, because he used the vaccinia virus, which is cowpox, to protect a boy against smallpox. So the word vaccine is actually derived from vaccinia, which is the name of cowpox. And it was determined that if you were exposed to cowpox, you actually never got smallpox. So it was actually an observation that milkmaids who milked cows who get cowpox never got smallpox. And so Jenner thought that, okay, if I can give somebody cowpox, I protect them from the much more debilitating disease that is smallpox. Until then, they were exposing people to a little bit of smallpox, and that could go wrong sometimes. But in this case, the first vaccine was in 1796. Subsequently, we developed a number of other vaccines. In 1938, we got the yellow fever vaccine. I'm sure we're all aware of. Everybody sees when the health workers put drops on the tongue of a child. In fact, in Ghana now, we're moving away from oral polio to injectable. But oral polio vaccine was developed in 1963. And you can see the timeline before SARS-CoV-2, the big agent of COVID-19. So as you can see from this timeline, vaccination is not new. Vaccination has been around for a very long time. And currently, as the Director General himself said, we have vaccines against more than 20 diseases. 1955, measles is 1963. And I think you can all see that immediately following the rollout of these vaccines, you have a significant decline in the number of cases. The graph there is showing them in hundreds of thousands. So you had 200,000 people with diphtheria. Within 5 years of using the vaccine, that had dropped to about 100,000. And then another 5 years, you drop down to tens of thousands, and now you have 0 diphtheria cases. The same for polio and the same for measles. The inset there actually shows what happens when you stop vaccinating. So this is data from the United States, a country that has no reason to have measles, given that they have the vaccine freely available. But due to lack of adherence and resistance, you find that in 2019, you have a significant increase in a number. You have over 1,000 measles cases in a country that up until then had 0 cases. So that shows that vaccination has to be rolled out and we have to adhere to it. Worldwide, as the minister said, or the Director General said, 3 million lives are be saved by vaccination every year. This is a little bit of data from Ghana. I know Dr. Atiano will walk into this in more detail, but I wanted to just provide some context. In Ghana, our extended program of immunization started in 1978. And you can see this is data for measles in Ghana. The top line shows the coverage. You can see that we have well over 90% coverage. And you can see that the number of cases of measles also significantly dropped in Ghana once we began rolling out the measles vaccine. So this is really data demonstrating that vaccination works at preventing disease. And it has worked around the world, and it has worked in Ghana. So what is a vaccine? There's a lot of noise these days in social media and different platforms about what vaccines are. So I'm going to try to walk you through. These are WHO actually facts that I've pulled. So it's not even my own words, even though I have spent the last, my whole adult life studying immunology and studying vaccines. But this is what a vaccine is. It's a simple and a safe and an effective tool to protect people against harmful diseases before they come into contact with them. So it is not a treatment. A vaccine does not treat you after you get the disease. A vaccine is a preventative tool that has to be administered before you get into contact. That is the reason why for many of the vaccines in Ghana, we immunize children soon after birth before they have any chance to come into contact with a pathogen. So a vaccine is simple. It is not a very complicated mixture. It is very, very safe, and I'll explain why. And as I've shown you in the previous slides, vaccines are highly effective at preventing diseases. Now, there's a lot of talk about how vaccines are artificial. Why not let your body deal with a disease naturally? Vaccines actually depend on your body's natural defenses. So a vaccine uses your body's own natural defenses to build resistance and makes your immune system stronger. Since COVID arrived, we've heard a lot in our media about immune boosters, drinking some concoction or something that will make your immune system stronger. I can tell you for a fact, the single most effective immune booster you can take is a vaccine. All these drinks you take, whether it's orange juice or Percocet or whatever it might be, a vaccine historically and today is the best immune booster. So if you want an immune booster, when the COVID-19 vaccine arrives in Ghana and you are one of the people who is able to get it, please go and get it. That is the ultimate immune booster. And it boosts your immune system by training your immune system to create proteins that we call antibodies, just as it does when it's exposed to a disease. So what a vaccine does is it short-circuits that process, so you now don't have to get the disease. The vaccine does not give you the disease, but it allows your immune system to make the antibodies that are required to protect from the disease. So basically, you get the benefits of being exposed without the negative side effects of actually having the disease. So I said vaccines are safe. How do we know they are safe? They are safe because every vaccine has to go through a rigorous process of validation for both safety and effectiveness. Initially, a vaccine starts in a preclinical stage. That is work done in labs like ours, where a lot of it is done on cells in a petri dish or in animals to determine whether or not whatever material is being used, is tested as a vaccine, has any potential for being a vaccine. Once this preclinical stage is over, the targets that are identified are taken through three phases of human testing. Phase 1 is purely about safety. It is done in a very small number, usually not more than 100, usually about 20 to 40 people who are very young and very healthy. So they are the strongest, you could say, in our community, in our population. These are volunteers who volunteer to be tested with this vaccine. After that phase, they are basically assessing people who receive the vaccine for any negative reactions. What happens to them when they receive the vaccine? After that, after the vaccine has satisfied the safety assessment, it is then passed into a phase 2 trial, which is also another safety assessment, but now is done in hundreds of people. The idea is maybe those 40 people were just super strong and didn't get anything. Now you want to take a larger sample size of several hundred people and see what happens to them when they administer the vaccine. You also, at this point, are able to ask whether the vaccine is able to stimulate or activate your immune system. After you pass phase 2, then you enter phase 3. This is where we ask, does the vaccine work? In this case, you are vaccinating thousands of people, not just 1,000, but several thousands of people. And you are asking, do people who receive the vaccine have a different response to the disease than those who don't get the vaccine? So phase 3 trials are where we ask the question, is the vaccine effective? But of course, because we are now vaccinating thousands of people, we are also continuing to assess the safety. No vaccine is approved unless it has gone through all these stages. So any vaccine that the Director General and the Ministry of Health are bringing into Ghana will have gone through every single stage to get final approval, initially by perhaps the WHO and certainly by our own FDA in Ghana. So this figure just shows you the expansion of people as you go. So there's a lot of talk about the types of vaccine. There's a lot of controversy about how these COVID vaccines have been made. This is a slide just trying to explain there are different ways to make vaccines. I like to think of it as you need a car, you have different brands of cars, they have slightly different technology. They all aim to achieve the same thing. So there are certain vaccines that make use of the whole virus or bacterium. You can think of that a little bit as maybe the slightly older way we used to make vaccines, but it's still quite effective, where you take a weakened form of the virus, or you take a different virus that is expressing a protein from the virus of interest. There are a number of current vaccine candidates that are employing this technology. I've highlighted a few of them that are relevant to our discussion here. Number one among them is the AstraZeneca vaccine that I'm sure you'll be hearing about today, Sputnik 5 and Sinovac. Johnson & Johnson have a vaccine, but that is currently in phase 3 trials. The ones in bold are ones that have been approved in at least one country. The other type uses a component. We call it a subunit vaccine. Now, that is not using a whole virus, but it's using a piece of the virus. So you could think of it as maybe a protein or something from the virus that is included in the vaccine. The Novavax vaccine that is currently in phase 3 is an example of that. And then finally, there is just the DNA. You may have heard that SARS-CoV-2 is an RNA virus. So there are certain vaccines that instead of putting in the whole virus, which is protein and its RNA and everything else, you just pull out the RNA from the virus and use that as a vaccine. Now, I should say, there's no way that RNA is going to integrate with your DNA. So that kind of myth should be busted, okay? There is no way that RNA from a vaccine is ever going to change your own genetic material. It is just a way to produce the vaccine. And so those are the three forms of vaccines, three types of vaccines. And so Pfizer and Moderna are examples of the genetic material vaccine. So currently there are lots of vaccines in development. You have 80 vaccine candidates. You have 212 trials currently going on. And we now have 11 approved vaccines. So these are vaccines that have been approved in at least one country. Some have been approved by the European Union. Some have been approved by the WHO. So not every vaccine is going to be available in every country based on that individual country's regulations. Ghana's FDA will decide which vaccines of these 11 and any subsequent ones they will approve for Ghana. Next slide, please. So finally, I just want to end with the current situation. COVID-19 vaccines are hopefully arriving in Ghana very soon, but they have been in other countries already. Currently, 188 million doses as of February 17th have been administered worldwide. We're not talking 2 million or 3 million, 188 million doses. So 188 million people have already received at least one dose of COVID, of the SARS-CoV-2 vaccine. The United States has done 56.28 million doses. China has done 40.5. The whole European Union has done 23.38 million. And the UK has done 16.5 million doses. Now, if we are looking at, next slide, please. Now, if you want to look more at the proportion of population that has been vaccinated, Israel has led the world. Israel has already vaccinated 47% of their population, vaccinated 23% of their population. These are the same vaccines that are coming to Ghana. So if you want evidence of the safety, well, 188 million have been already administered elsewhere, and there have been very, very few, if any, adverse reactions reported. So once again, if the phase 1, 2, and 3 trials are not enough to convince you, 188 million more doses have been now administered, and there are very few reports of any negative reactions. So once again, this vaccine is safe. Now, is it working? Israel, I said, has already vaccinated 47.6% of their population. This week, they reported that in a study of 600,000 vaccinated people, they saw a 94% reduction in symptomatic COVID disease. So in the people vaccinated, it appears to have an efficacy of at least 94%. So bottom line is the vaccine is working, and there's no reason why Ghana should stay behind and not take this vaccine. So with that, I'd just like to thank you very much for this opportunity, and welcome any questions if there are.
I think we can give Dr. Bediako another round of applause. Doc will be on standby to take your questions and respond to them. And Doc, maybe I'll give you one question even before we get there. And at this point, I want to invite Dr. Kwame Amponsa Achiano to the podium. He's now going to talk about Ghana specific. So which of the vaccines are we getting? What are the numbers? What are the timelines, et cetera, et cetera. But Doc, please note this question for me. There are all these videos flying on social media that these vaccines are an anti-African conspiracy to kill Africans. When you take it, one of your eyes will no longer be functioning, or half of your body will be paralyzed, all sorts of stories. I want you to take a note of it and respond to it for us, because I'm sure you've seen a bit of it. So Dr. Achiano, welcome. What do you have for us on Ghana's vaccination rollout program specific?
Thank you very much, Honorable Minister Designate, for information. Honorable Minister Designate for Health, colleagues, distinguished ladies and gentlemen, I am happy to be here to walk you through the National Vaccine Deployment Plan for COVID-19. To do that, I would like to walk you through the mandate of Ghana's immunization program and some key achievements, narrowing it to Ghana specifics based on what the previous speaker has just presented. Then we'll talk about why COVID vaccines. I think he's already touched on that. Then the COVID vaccine deployment plan itself for Ghana. And then some key activities that we have already conducted. And then a few key next steps. Yes, so the previous speaker mentioned that we started our immunization program in 1978. So for a little over 40 years, we've been vaccinating people. Vaccines save lives. And for us as EPI, our mandate is to reduce the burden of infectious diseases that are immunizable. In other words, infectious diseases for which vaccines can cure or prevent. So we started with 6 diseases in 1978, and I'm sure that people still will relate to the 6 childhood killer diseases. And even today, people are still talking about 6 childhood killer diseases. We've moved far off from there, and currently we are doing 13 diseases plus the recently introduced malaria vaccine, which is in a pilot form, making it 14. So the timeline here shows the trajectory of vaccine introduction and the key antigens that were introduced for specific years. So from 1978 to 2018, we have a gamut of vaccines that have already been introduced into the country, fighting against tuberculosis, polio, myelitis, diphtheria, pertussis or whooping cough, tetanus, measles, yellow fever, hepatitis B, Haemophilus influenza, pneumococcal diseases, principally pneumonia and other invasive pneumococcal diseases, rubella, which is now part of the measles vaccine, and of course, we've also recently introduced IPV, as he mentioned, which ultimately will replace the oral polio vaccine. IPV is inactivated polio vaccine. And I'm also sure you know about the RTSS, which is a new malaria vaccine that is currently under pilot. So initially, the main target was children and women, but now, with a life course approach, we have expanded it to all ages. And that is why some of the times you would hear us drumming campaigns for yellow fever and measles and so on. Yes, so we have chalked some successes, and these are a few stories I would like us to look at. The Honorable Minister already mentioned that we have a robust routine immunization program. In fact, within the sub-region, Ghana's program is touted to be one of the best, if not the best. We've conducted several mass vaccination campaigns against many diseases for both children and adults for over 5 decades. Notably is polio, of course, measles. We've also done yellow fever, meningitis, and tetanus in campaign forms, apart from the routine. We have had high immunization coverage over a long period of time for most of our antigens. Most of them are above 90% coverage. So if you pick for children, for every 10 children you pick, at least 9 of them would have been vaccinated. And it's even higher for campaigns. For campaigns, we are getting about 95% and over. And notable achievements include reduction in many infectious diseases. And the next slide, I would expand a bit on that. You've seen this slide already from the previous speaker. This is a bit updated for up to 2020. So I won't talk too much about it, except to say that, as he rightly said, as a coverage, the top one is for measles. As coverage of measles vaccine improved, the number of cases dropped drastically. It is also so for the one on the lower right side, that is for yellow fever. As the coverage, the red line shows the coverage of yellow fever routine. And as it went up, yellow fever, the bars, the number of cases also reduced drastically. We also introduced Rotavirus Vaccine in 2012. If many of you will remember, we used to call it 2 new vaccines. So one of them was rotavirus, and a study that has been published by Professor Sama and team suggested that hospitalizations from rotavirus diarrhea had also reduced immediately after the introduction of the rotavirus vaccines. So to summarize the success stories in Ghana, immunization has conquered most children or childhood immunizable diseases, notably neonatal tetanus. This was eliminated way back in 2011 after a study by the WHO and UNICEF, who visited the country to look at our system and also look at neonatal tetanus within the country. We have not recorded any wild polio virus since 2009. And we have contributed to the success of Africa eradicating wild polio. Of course, we know that there are other forms of polio that recently worried the sub-region. We have not documented any death from measles since 2003. I'm sure the old physicians here will tell you that somewhere in the 70s and 80s, measles was only second to malaria in terms of childhood deaths. But recently, it will even be difficult for a newly trained medical officer to diagnose measles because they don't see them for training. We've also had some reduction in pneumonia and diarrhea, as I mentioned, for diarrhea, the rotavirus diarrhea in children. And we've eliminated one form of meningitis, the one that is due to the type A Neisseria. If you recall, in 2012, we carried out mass campaigns in the northern parts of the country where they used to have cyclical outbreaks almost every 10 years. And after that campaign, we've never seen this type of germ. So in a nutshell, immunization has contributed to reduction in deaths of children less than 5 years. And as the Ghana Demographic and Health Survey would tell us, in 1988, we had as many as 155 children under 5 dying for every 1,000 live births. Now, up to about 2017, is reduced to 52. And thanks to immunization and other childhood interventions. In fact, there's attribution is not to immunization alone, but immunization has contributed greatly to that. So why COVID-19 vaccines? Again, the previous speaker has done justice to that, but you recall that somewhere in March, towards the middle of March last year, WHO declared COVID-19 as a pandemic, meaning the outbreak, which had started in China in the previous year around November, December, had crossed several continents. And for us in Ghana, immediately WHO announced it. The following day, we had our first 2 cases. That was terrible for us. But thanks to interventions from, I think it's 2020, not 2021, sorry. So after we recorded our cases, response strategies have actually been mainly physical and social barriers and hand hygiene, talking about face masking, physical distancing, hand washing, and hand sanitizing. Along the line, we even went under lockdown. So these are all the physical barriers and social barriers that have been used to control this outbreak within the country. With that, global efforts had been stepped up, and some vaccines had been discovered. And as the previous speaker again said, several countries have started deployment. I think it's over 50 countries. And we know COVID-19 vaccines are only an additional measure to the implementation of all the other interventions, as originally espoused by the Director General and the previous speakers. Next slide, please. Yes, so the potential benefits of COVID-19 vaccines would include the following: that it will contribute to the reduction in ill health from COVID, and of course the associated deaths. It will also help reduce the disruption of social and economic functions. It will enhance the mental and psychosocial well-being of Ghanaians. People are tensed, but there's a lot of psychosocial issues, or there are lots of psychosocial issues when it comes to even hearing that a friend has COVID. It will also facilitate smooth cooperation in relations between the country, that is ourselves, and the global community. And in no time, when vaccines become much available, when there are lots of vaccines in the system, there's a likelihood that it will be demanded as a proof. I mean, one will need to prove that he has COVID vaccine before traveling, just as is being done for yellow fever. And with all this, Ghana is preparing to deploy COVID-19 vaccines tentatively from March. That is about 2 weeks away. So with the availability of vaccine candidates globally, Ghana has drafted its national vaccine deployment plan to aid rollout. In fact, you can't do any meaningful thing without planning. And this vaccine will be part of the preventive measures, as the previous speakers have already mentioned. The plan is quite comprehensive, and it outlines major new components leveraging on existing systems to protect the population. It is a product of several engagements, commitments, work sessions, review of available documents and guidelines involving several partners, health partners, and the civil society. Yes, so this is the roadmap for developing the plan. First, once we knew that there were candidate vaccines in the pipeline, we started thinking about ourselves, the cold chain bit, the deployment bit, and so on. So we started as far back as October 2020. The National Immunization Technical Advisory Group, which is a body constituted by the Minister for Health to advise the ministry and by extension the government on policies related to immunization and other technologies in that regard, had several meetings after they had reviewed the literature when the candidate vaccines were being developed. So they produced a policy guide that was used as part of the various guidelines that we reviewed to help us do the planning. So a COVID-19 technical working group with several subcommittees of experts were constituted, or was constituted. And basically it involved the Ghana Health Service, the Ministry of Health, health partners, and the civil society. We organized several work sessions at the committee level. Individual committees worked on aspects of an initial plan. Then this culminated in a workshop which was organized to consolidate the plan and the budgets. And this was done during the middle towards the latter part of last month. Yes, so a brief walk through the components of the plan. Of course, for any document, you need an introduction. The plan also talks about how we're going to regulate and monitor safety of the vaccine. And this was done together with the FDA, a planning and coordination of the deployment exercise, the vaccine strategies, the vaccination strategies, how we're going to deploy, or the deployment systems and modalities, how do we monitor people who have been vaccinated, the data bit of it. And most of these vaccines are 2. Each person has to receive 2. So how do we monitor to get information to the next person, to those who have already been vaccinated, to come for the next vaccination? The operational issues, surveillance on the disease, communication and information sharing, the supply chain processes, the vaccines, the devices, the cold chain, waste management, because these are injectables and they're going to generate a lot of waste. And then, last but not the least, monitoring and evaluation in terms of the activities. So for the choice of vaccine, The country used the open-mindedness approach. We're not tied to any particular vaccine. This was based on local and international recommendations. So in prioritizing the vaccine choice, we considered several issues. Key amongst them was the vaccine must be safe. It should be efficacious. In other words, it should work. And not just efficacious, because efficacy is when you are talking about ideal conditions. In the under normal conditions or the world conditions, it should also be effective. How is it formulated? Is it liquid or powdered? How easy is it to be stored? What is the cost of the vaccine itself and then the cost of delivery? And how feasible it can be delivered? The availability, and of course, it has to pass regulatory approval. So based on these, we came up with a list. This list, as you say, has multiple vaccines within it. But as I said, one cardinal thing is regulatory approval. And to date, I would say that the FDA has approved AstraZeneca and Sputnik V within the country. So it's passed what we call the emergency use authorization. But of course, we've also considered other vaccines in the pipeline: Moderna, the Pfizer, Sinopharm, and of course, Johnson & Johnson, which is a bit far away because the phase 3 is still ongoing. So, just a few highlights. Because the requirements for regulatory approval of the COVID vaccines has been provided by the FDA. Included within that is a clear pathway to ensure that we monitor safety, jointly by the Food and Drugs Authority and, of course, the Ghana Health Service structures. Yes, the plan also talks about distribution strategies based on segmentation of the population. There's a lot of pressure on the vaccines. The whole world is on the same manufacturers. And so we know that we will not get the vaccines en bloc for the entire population, and therefore it's going to come in trickles. And so we had to do a kind of segment, have effectiveness in delivery. So ultimately, the vision is to vaccinate the entire population. But for now, the initial target, based on the safety profile of the vaccines, we are targeting approximately 20 million persons. And these persons are health workers, this is based on the segmentation, persons with underlying health conditions, security personnel, other essential service providers, persons above 60 years, students of second and tertiary institutions, teachers at all levels, specialized groups, called the executive, legislature, judiciary, the MDAs, the media, and of course the rest of the population will receive the COVID-19 vaccines. We're going to use a mixed bag of delivery strategies. We use static, that is where we use fixed clinics. There are already existing hospitals, health centers, clinics, both public and private. We'd also conduct outreach services depending on the area, because there will be mobile clinics, temporary mobile clinics, where people go vaccinate and move to the next spot. There will also be camp out. Camp out is usually suited for those colleagues or citizens on the islands and the riverine areas, where health workers pack bag and baggage and go and sleep on the islands for about a week or so, complete the vaccination exercise, and come out. And of course, we use a combination of these depending on the situation. So the vaccines or vaccination will be expanded to include children and pregnant women as time goes on and as more safety data become available. Yeah, so this slide is giving us the highlights of the target groups and the potential delivery strategies. So for the target groups that we mentioned earlier, depending on the target group, we have designed a potential delivery strategy. So for example, for health workers, there will be fixed sites. For persons 60 years and above, we use a combination. For those with underlying conditions, we also use a combination of fixed sites and outreaches. And the potential vaccination sites are what you see on the right side. So we use a mixed bag of health centers, hospitals, public, private, outreach points, the community pharmacies, the markets, drive-thrus, and even workplaces, depending on the target. And for those who have special conditions or specialized populations, we use specialized strategies. Next slide, please. Yes, so in the vaccine delivery strategy, we made an assumption, and we think that the assumption is working. Global vaccine supply will span a long period, and as we see, most countries are getting the vaccines in trickles. And therefore, vaccine deployment for us will be staggered in 3 phases. And this is based on the groups that you see on this slide. Yes, so we're looking at group 1 by way of segmentation, persons at most risk. And these are principally frontline health workers, frontline security personnel, persons with known underlying medical conditions, people 60 years and above, frontline members of the executive, legislature, and the judiciary, because the country must run. If you need money, parliament must approve, and so on. So for those that are in frontline, they are segmented to receive the vaccine. Group 2 will look at other essential service providers, including the rest of the security agencies. So again, you see a tall list for those who give us water, electricity, our teachers, our students, those who are the fuel pumps, farmers, and those within the food chain, telecommunication services, air traffic control, civil aviation, meteo, air transport services, and waste management, the media, the rest of the public, and of course, commercial transport service providers. And then finally, the group 3 will be the rest of the general population, all persons 18 years and over, excluding pregnant women. Let me say that this is not cast in iron, so depending on the situation, we have made it quite fluid. And again, we have segmented based on the hotspots, as you see on the next slide. But before that, as I said, because the entire population is targeted ultimately, when we have enough information, then there will be a group 4, which is the pregnant women and their children. So as this slide depicts, you see that there are some areas that are deeply red and some almost black. If your geography is quite good, you see that Greater Accra is almost black, and these are the hotspots. So further segmentation based on the few vaccines that we are likely to receive in the next couple of weeks, maybe next week or so. We are looking at Greater Accra Metro, the Greater Kumasi Metro, and of course, Western will be the next. As you see on the left side of the map, Western is also quite heavily affected. Next slide, please. Yes, so human resources would be enormous. We need a lot of vaccinators for this exercise, so we have planned to train approximately 12,500 vaccinators and nearly 40,000 volunteers with a little over 2,000 team supervisors. And these will be used for both the round 1 and round 2 of the campaign. Remember, we said that the vaccines are given in 2 doses. Of course, there will be micro-planning where the activity itself will be done at the implementation level. So that's where they will look at the fuel, the communication, the transportation, the cold chain, and so on and so forth. And of course, we have planned a training for vaccination teams to assure quality. Cold chain and logistics, we've identified a few gaps, and for now, throughout the country, of 260 districts, 15 districts will require new cold chain equipment, while 7 regional health directorates, basically the new regions, plus Central Region will also need a working code room over time. These requirements are obviously based on characteristics of the chosen COVID-19 vaccine meeting or matching the existing routine storage and transport system in the country. And for us in the country, we store our vaccines at +2 to +8 degrees centigrade or Celsius. The entire health system, however, will have to be revamped with new cold chain equipment if we're going for the negative or those that require ultra-negative cold chain. And that is also part of the plan. You would agree with me that safety should be a priority. And therefore, a number of activities have been planned with the FDA, including doing both active and passive surveillance during and after the campaign. So adverse events following immunization will be closely monitored, managed, and reported. Of course, because these vaccines are injectables, there's adequate provision for injection safety logistics because safety starts with the first injection. All trainings will be restricted to smaller groups with a mixture of virtual and in-person practical approaches. Because for some of the training modules, you need to demonstrate, and people must also demonstrate. So, but how we would want to adhere to the COVID-19 preventive protocols as much as possible. That's why we'll do that in small groups, so that we don't add insult to injury. In an attempt to prevent COVID, you don't create more problems. Yes, the estimated costs. We are looking at, for every person getting 2 shots, that would cost about $2.6, nearly $3 per person fully vaccinated for the 2 doses. And we are aiming at vaccinating 20 million. So, yes. So what have we done so far? Yes, so the plan has been presented by the Honorable Minister and the DG and the other team members to the Presidential Task Force for COVID-19 response. We also presented that to WHO. They reviewed it, the Afro region, and made some inputs which we have incorporated. And I'm sure many of you have heard of COVAX. COVAX is only a facility that is supporting countries with equitable distribution so that the giants don't take all the vaccines away. So COVAX is giving us vaccines for approximately 20% of our population. And there's a requirement that we have a plan, and that plan should be uploaded on the WHO website. So we've done that as a draft. Led by the Honorable Minister, the ministry has also engaged a number of experts and professional groups, some of whom are here. They made quite some useful suggestions which we have incorporated into the plan. And let me reiterate that a plan is a living document. So even from here, we'll still go and update it. So the Ghana Academy of Arts and Sciences, the Ghana Medical Association, I see the president here, the Ghana Pharmaceutical Society, or Pharmaceutical Society of Ghana, the Ghana Registered Nurses and Midwives Association, I also see the president here, the Allied Health Group, and then the Ghana Psychological Association. Because the deployment subcommittees have been working day and night. Some of them leave as late as 12 midnight, 1 a.m., trying to adapt and finalize the operational plans. We've developed a communication strategy with key messages, and other stakeholder engagements have been planned together with the Ministry of Information. Logistics plan has been completed. There's also a near completion of the safety surveillance guide, which would also guide us in the safety monitoring. And of course, as I speak now, the training and service delivery subcommittee are working on the models, adapting what other countries have used. And of course, as we know, there's nothing new under the sun. So potential sources of vaccines have been identified, including both multilateral and bilateral agencies. So I mentioned the COVAX facility, the African Medicine Supplies Platform, M-Pharma. The bilaterals include the Tony Blair Foundation, the Ghana Private Sector Fund, and I think I missed out the AU, the African Union. So these are the expected initial doses, a little over 350,000 doses of Covishield, which is the AstraZeneca vaccine produced by the Serum Institute of India, are expected in the country by next week and towards the end of February, latest. So these are a few next steps. Fund security, I know the Minister, Honorable Minister of Health designate, is working assiduously with the team on that. We'll continue with our subcommittee work. Then we'll accelerate the phased implementation of the plans once the first vaccines are in country. And the deployment, we hope, will span March to October 2021. Yes, distinguished ladies and gentlemen, this is the way we do it. We have had a lot of experiences with campaigns. We have the men and women to do it. All we need is your support. So we go to the islands, we go to the forests, urban areas, we sail on the lakes, we wade in the waters, and our gallant health workers have been doing a great job on this, and we know, we trust they will do it. So we are all in this together, and everyone's support is needed in these abnormal times. Distinguished ladies and gentlemen, before I put my mic down, a few acknowledgements. Of course, the technical working group and the subcommittees are doing quite a lot of work. The National Immunization Technical Advisory Group also did quite a lot. All our health partners involved in developing the plan, the World Bank, WHO, UNICEF, PATH, GSI, CDC, the CSOs, USAID, UNDP, DFID. Of course, the health professional groups have also supported in shaping the plan, the Ghana Academy of Arts and Sciences, the COVID-19 task force and coordinators, because the honorable ministers designate for health and information, and the teams at both the MOH and Ghana Health Service, Ministry of Information, the Information Services Department. Distinguished ladies and gentlemen, vaccines save lives. I thank you for your attention.
Thank you. Thank you. Thank you, Dr. Achiano. Minister Designate, I would want you to make some, may I say, wrap-up remarks for us at this point. And then after that, I would invite, because the Minister Designate has to attend to another activity on the same subject of COVID. There's another activity going on COVID, so he has to attend to that one. So I'll give him the final words on this. And then at the same time, let me invite Dr. Bediako, Director General, please join us. Dr. Achiano, take your seat. We are now at the firing squad level, where our colleagues from the media will have an opportunity to raise a few questions.
Thank you, Kojo. Distinguished ladies and gentlemen, our friends from the media, unfortunately, I have to leave you at this stage. But all I want to say is that you have seen the preparations that we have made so far to get vaccines into our country and to vaccinate everyone amongst us in the country. I said earlier on that we are just getting ourselves into strategic partnerships. You are going to help us market the benefits of vaccination and try to push down the anti-vaccine campaign that some people have started adopting in the country. We all need to be vaccinated, and it is my plea on behalf of government that you support us in this drive. After the presentations that you saw, the only single antidote now that we haven't found any medicinal concoctions to do COVID. We don't seem to have options. We cannot continue to live in the COVID environment forever like this. So we all have to do something, and that thing should be done as quickly as possible. Our success in this campaign we are just about to embark upon will depend not only on government, not only on those of us who are at the front line, but you, are going to play a very significant role in getting our message to our people. The Information Minister will continue to engage you. And I believe what we have heard here this morning, and after you have asked questions for clarifications to satisfy yourself, you have a lot to also put into the public domain on our behalf. Let me thank you at this stage for attending to our call, and I'm very grateful that you join us in this discussion. Thank you so much. Thank you.
Honorable Minister-designate, thank you. We know you are handling multiple schedules at this time, especially as you don't have deputies yet, but we're grateful. Colleagues, this is the time where we are able to take questions and provide some more clarification. So to our invited guests and to our colleagues in the media, we'll mount one microphone here. We have just about not more than 20 minutes, because you know public gatherings have a fixed timeline. So not more than 20 minutes within which we will take questions. I want to just reiterate the first question that I mentioned to Dr. Bediako about some of these myths. Which one is true, which one is not true? So, Doc, maybe you want to take that for us while we get ready to take the other questions.
Okay, thank you, Honorable Minister. I'd just like to say, as I said before, this vaccine has been rolled out already in several countries. And these are the same vaccines that we are expecting in Ghana. So the myth that this vaccine has been engineered specifically to harm African people is completely flawed, because we are receiving the same vaccine that is currently being administered in Europe, in North America. And of course, as I'm sure you are aware, there are people of African descent in Europe and North America who have taken this vaccine. In fact, I know personally people, African Americans, who have taken this vaccine and have had no adverse reaction. So it is completely baseless to think that this was somehow engineered to harm Africans. If anything, we are behind the game. We are late to getting the vaccine. So we should be clamoring to get it and not being worried about it being engineered for some reason to harm us. So no, there's no basis for that claim. And as we've said, our own FDA has no vaccine will be administered here that has not been approved by our own FDA, and I believe they are well capable to assure us of its safety.
Thank you. I do know that the head of the FDA has joined us, Mimi Delis-Darko. I've not hinted her ahead, but she's my big sister, so I can surprise her. And I beg of her to tell us something about safety. Have they, what is the word? Is it licensed or approved? FDA approved. Have they approved any vaccines so far? What are the stories on safety? I'm sure they've seen paperwork from other places. What is it looking like in terms of safety? So, Mrs. Darko, if I may please ask you to, can we get the microphone here behind the podium so that she can quickly address us on that? Then we'll come back to take more of the questions.
Authorization pathway to authorize the two vaccines that we have at the moment. That is the Covishield, is the AstraZeneca Oxford vaccine manufactured by Serum Institute of India, and what you call the Sputnik V, which is manufactured by a company in Russia. Now, emergency use authorization is a pathway that we use That pathway is just to ensure that a needed medical product, especially in a pandemic, is made available in a timely manner. So the only thing that is different in emergency use is that we do it quickly. We have not bypassed any safety or efficacy standards that we would normally look out for. We just ensure that we do it faster so that the product can be made available in a quick and timely manner. So just to assure you that all the things that we have to do to ensure that a vaccine or a medical product is safe, we have done for these 2 vaccines. As you were told, after the vaccine has been authorized, as with every other product, the safety has to be monitored. And we have put together a nationwide safety surveillance system. That is the same system that we use for all vaccines that are used in the country. And every person who is vaccinated will be followed up actively to ensure that any adverse event that they experience will be reported, it will be managed, and it will be, the causality will be assessed. Sometimes you can experience an adverse event that may not be related to the vaccination. So we look at every adverse event report to ensure that we have assessed what we call causality, to see whether it was related to the vaccine. We will do this follow-up with the EPI, and it is nationwide. So no matter where you are, if you are vaccinated, you will be followed up. We will do this through a system that may use phone calls. We launched an app called the Med Safety app in 2019 that you have on your phone. So if you are vaccinated and you experience anything, you can report it. There's an online reporting system, there's a hotline, and there'll be dedicated safety numbers, mobile numbers that you can also use. We are working with the EPI to train all healthcare professionals on what to expect following vaccination. And we've been monitoring the international scene. So for anybody who's used Sputnik, any country that has used it, we know the adverse events that have currently been experienced. And so far, it is the normal slight temperature, chills, some injection site reactions. We have not got any adverse events of special interest that causes us concern. If anything like that comes up, because we are also working with all the other countries within the WHO drug safety monitoring system, we will hear about it, and then we will make it known to the healthcare professionals. We have also put together a 13-member expert committee that will be working with us. We always have an expert committee that works with us on adverse events. We've put together from 3 different adverse committees that we have, safety committees that we have, and we put together a 13-member committee that will ensure that causality is assessed as soon as we receive a report. And we'll be reporting back every week on whatever we've received, just to assure Ghanaians that we are actually doing what we are supposed to do. I always add that, just to assure you that the FDA is a maturity level 3, and in pharmacovigilance, which is safety, we are maturity level 4. Very few of them in the world. And we are also a regional center of excellence in Africa for safety monitoring. And we've been a member of the WHO Center for International Drug Monitoring since 2001. So we have effectively monitored new vaccines like the measles, rubella, yellow fever, rotavirus, pneumococcal vaccine that was introduced a few years ago. And recently, we monitored effectively the safety of the malaria vaccine. So we assure you that we have a good safety system in place, together, working together with the EPI and working together with the staff in the safety department and the expert committees. Thank you very much.
Thank you very much. Thank you. Thank you very much. Thank you very much, Mrs. Daku, for that update. Colleagues, it's time to take your questions. So if you have any questions, please step up to the microphone. It's already been set in the aisle. We'll take the first 4. 1, 2, 3. Is there a 4th? 4. So 1, 2, 3, 4. Please space out. Let's make it snappy so that we can get responses. Can we have the microphone activated, please?
Hello. Good morning. Thank you for the opportunity. My name is Martin Asiedidati from TV3. First question maybe to you, Information Minister Designate, are we able to tell whether the President and the leadership of government would maybe do a public showing of taking the vaccine as part of efforts to expel the rumor that, this is targeted at, wiping out Africans, So if there's a strategy like that, can you kindly tell us? Secondly, what then again is a strategy to deal with apprehension? We heard that Dr. Kwame Amponsah-Achano gave specifics as to the first group of persons to take it. Looking at the fact that Dr. Kumawaji said our numbers are still high, although they are rising slowly, people might also want to, there might be a rush to get vaccinated. What is the strategy to deal with apprehension? And finally, do we intend bringing an Ebola vaccine anytime soon, also considering the fact that we have already started recording some in some neighboring countries? Thank you.
Thank you. So Ebola, I'll defer to DG of Ghana Health Service on that. We'll take the first to myself. Yes, sir. Please introduce yourself.
Good morning. My name is Akokraba from Kasapa FM. My question goes to Ms. Dr. Amponsah. I mean, the development or the distribution strategy, we realized that there was omission of basic schools in your distribution process. We want to find out what is the rationale behind this. Are we not going to include them in the distribution process? And then also, may you please reiterate the cost involved in the dose per dose? I think you gave a cost, and I think it would be better if you trade it for us too. Thank you very much.
Thank you very much. Ghana News Agency.
Yeah. Thank you, Honorable. First, I want to congratulate you for your precision in answering questions in yesterday's vetting. Even though I realized at the time that you were tired, but you were very tough in mind, mentally tough. My first question, my name is Atamensa Godo from Ghana News Agency. My first question goes to Dr. Achano. I stand to be corrected, though, that when the vaccine or any vaccine is exposed to the heat or certain temperature, it affects its potency. I want to find out, as you rightly said, the vaccine that you are going to administer is supposed to be stored between 2 and 8 degrees Celsius. I want to find out what mechanisms have you put in place so that when the vaccinators go to the field and it exceeds the temperature specified, it's not going to create any problem for those who are going to take it. Then I want you to specifically mention the date that this exercise is going to start, the specific date that this vaccination is going to start. Then my third question is, you said pregnant women and children will not be included. Has there been any vaccination anywhere in the world that has proven harmful to pregnant women and children? Thank you.
Thank you. We'll take the final two on this set and then we'll move on. We'll very much like to stay with the fixed microphone so that you don't have to be touching the microphones and the stands. And since you've touched, can we please have his hands sanitized afterwards? We can't be preaching virtue and practicing vice.
Thank you very much, Right Honorable. Good morning. The problem is concerning vaccines and vaccination, which Radio France International, David Hutton. Thank you very much, Right Honorable, once more, and congratulations on your Minister Designate. The vaccination process which you are trying to roll out, we had Ebola, which had an experimental vaccine proposed. And then now we have the COVID-19, which is being proposed also with the vaccine. My question is, are the vaccines which will be used or coming into the country experimental, or they are into their final stage of immunization?
Thank you.
Thank you very much.
Thank you very much. So are they experimental vaccines, or they have crossed a certain threshold that we can call final? So I will come to you, Dr. Bediako, to respond to that for us. Yes, sir.
Okay. So good morning, Honorable Minister.
Please come closer to the microphone.
My name is Harry Ochre from the Pharmaceutical Society of Ghana. I have two questions. The first one is, who will be responsible for for product liability, vaccine liability, is it going to rest on the beneficiaries, on government, or the manufacturers? And
Who will be responsible for
liability?
liability?
Yeah.
Potential liability.
Yes, please. And then my second question is, when we were presenting on the deployment, with the health workers, I see health centers and a hospital, that is private and then public. And when it came to the persons focused on the 60 years and above, we see pharmacies. But the pharmacists or the people working in the community pharmacies were not captured as the people that we are targeting. So I want a clarification on that one. Thank you.
Thank you very much. So, Dr. Chanu, you deal with the potential liability, and I'm sure there's already existent a structure on what happens to potential liability during your normal vaccination programs. Let me respond to the two questions that were directed at government, and then I'll let Dr. Abuaje deal with one of the issues, and then I'll come to the others on the side. Yes, members of the executive, or some members of the executive will, as part of the demystifying process and the public education, will publicly take their COVID-19 shots. I'm not able to say who and who, but I do know that it has been agreed that some members of the executive will publicly take their shots. I will. I have volunteered that I will, and I'm aware that other people will also do same. Now, in terms of dealing with apprehension, not just apprehension, we need to create awareness, we need to sensitize people, we need to then deal with the apprehensions as well. The Ghana Health Service, working with the Information Services Department, the National Commission for Civic Education, the local government service, the Ghana Education Service, are working together to execute an elaborate communication program across the districts and then at the national level. In fact, today's engagement is the very first in a series of activities that will take place in the coming months to carry the entire population along. There are a lot of stakeholder engagements that have been scheduled, as I mentioned, starting from what is happening here today, and similar stakeholder engagements will be going on through to the last mile across our country and across the 260 districts. We're also expecting the National Commission for Civic Education and the Information Services Department and the Ghana Health Service to get out on what we call a public education campaign. So that is where you see vans, etc., in the communities, them visiting churches, mosques, markets, lorry stations, etc., and putting out the word, answering questions, and educating the general public. You, our colleagues in the media, will also be requested to play two roles. One, to provide the mass media platforms like you did right from the onset of COVID to educate the general public. And then secondly, working through the GJ, GIBA, Primpag, NMC, will be requiring of you to roll out what you call programming support, where you design your own programs, and then with the help and the benefit of local health staff in the various districts, engage the public and provide the necessary education, deal with issues that are coming on a regular basis. We've also got the weekly briefings that we'll be having at the national level, where we can give an update so that we know how many people have been immunized in Ghana or vaccinated in Ghana, how many of them are first shots, how many of them are second shots, have there been any issues. So just like how in the normal COVID program we update, even including a website, we'll do same on this one as well. Dr. Abacha, I want to come to you to respond to the question that was directed at you.
Thank you very much. I think my question is on the Ebola vaccine. Yes, it will be based on risk assessment by WHO. If the risk levels are high, a vaccine will be registered and then given. There's Ebola vaccine available. And so once they assess and they feel that the risk is high enough, the group that is exposed will be vaccinated. For now, we've not reached there yet.
Thank you, Dr. Boaje. I want to come to Dr. Chianu. There was a question about basic schools. We didn't hear of basic schools. Why is that? I want to tie that in with a question about pregnant women, because you mentioned it earlier, but we perhaps missed it. So deal with that, and then cost, cold chain, and date. Those are the four issues raised for you, sir.
Okay. Thank you, Honorable Minister Designate. Yes, so for the basic schools, in my submission, I didn't say they are excluded. If you remember, I said that the vaccines that we have were not tried in children under 15. And therefore, for now, they are in group 4. So when we have enough data on safety, they will be included. Remember, most children in basic schools are less than 15. They are 15 or less. And then that goes same for the pregnant women, because we don't have enough safety data. But let me tie it in with whether we have any vaccine that has proved harmful to pregnant women. For most what we call life-attenuated vaccines, that is, you have the germ itself, which has been reduced in potency. There's always a theoretical risk that the unborn child might be affected. So it's usually for the unborn child. And therefore, we are cautious until safety is assured. And it is so for even the other vaccines. It is always about the unborn child. So it's more of erring on the side of safety. But there are some times when inadvertently pregnant women are vaccinated. And once that is done, they are monitored. So for some of the vaccines that we have, for example, yellow fever, during campaigns, we give pregnant women, but otherwise, the general principle is that when somebody is pregnant, you need to err on the side of safety, unless there's a total risk that the person might lose their life. Yeah. The cost, I think I mentioned that for every person vaccinated for 2 doses, it's approximately 2.6 US dollars. So if you do the math, we are aiming at 20 million. So it's approximately 50 plus million US dollars for operations. The cost of the vaccine is a bit dicey because we have different vaccines with different costs, far ranging between 4 and 40. So for our planning purpose, we used an average of around 7 to 10. But this is subject to change. So for example, if you have Johnson & Johnson, it's only 1 dose, and therefore it's a bit fluid. So we can work with that, approximately $7 to $10 per dose.
Cold chain and date.
Yes, cold chain, we have a robust system. We have cold chain facilities from national, where we have the national cold room, regional cold rooms, district cold stores, and if you've been around for quite a time, you see that during campaigns, vaccinators and volunteers carry a special bag around their shoulders. It's called a vaccine carrier. Within that carrier, you have what we call conditioned ice packs, which would also maintain the cold chain. But then at the office, in the office where the vaccines are stored or stored in bulk, we monitor the temperature using an electronic type of temperature called a fridge tag. So we have experience in that, and normally when we train vaccinators, we take them through maintenance of cold chain and all. Yeah, there's also what we call the VVM, vaccine vial monitor, which is a small patch that is heat sensitive. And so once it crosses it changes to a certain color. Again, they are trained to recognize whether to use or not to use. So in summary, that's how we maintain our cold chain, and the system is quite robust in that aspect.
You didn't speak to date, and then I'll quickly
The
go
date,
to Dr. Bediako.
For now, is sensitization. When we have the actual date, we'll communicate.
Dr.
Thank you
Bediako.
very much.
So are these experimental vaccines, or they are at a stage that can be described as ready for use?
So these are not experimental vaccines. As we said, these have all gone through all phases of trial, have been approved by multiple regulatory agencies, including our own FDA. I think the gentleman referred to the Ebola situation a few years ago. That was the clinical trial. So that was there was a proposal to conduct a clinical trial in Ghana for at the time, developmental Ebola vaccine. That is very different from what is being done now. This is a national rollout of a fully approved, fully non-experimental vaccine. But if I could just add that we should not be afraid of clinical trials, though. Clinical trials are extremely important. And actually, a number of African countries are ahead of us in terms of getting access to COVID vaccine because they participated in clinical trials. So that is a different issue, but I think I'd take this opportunity as a scientist to try to say that clinical trials themselves are incredibly highly regulated, and so should not be something that as Ghanaian people we should be afraid of. In fact, we should be looking to increase our involvement because they improve our access to very necessary inputs such as vaccines. But I'll say again that in this particular case, the vaccines being described, AstraZeneca, Sputnik 5, and any other ones that will be rolled out by the Ghana Health Service are fully approved, non-experimental, fully approved vaccines for use in the general population.
Thank you. Dr. Chiano, there are two outstanding questions for you, but we have just about 5 minutes. Are there outstanding questions? One, please step forward. 2, 3. Any female questioner? So that I'll give priority. So, Doc, let me take these 3 so that you deal with all of it together.
You did say that the vaccine can stand the test of time. But I'm asking whether it is all-weather vaccine, because here in Africa, in Ghana for that matter, we have a different climatic condition. So are you saying that even if you bring it to Ghana here, it doesn't matter the weather condition, it can still stand a test of time? And Dr. Boaji, we all know that in this country called Ghana, when people are assigned duty to do something, they want something from it. How are you going to motivate the workers who are going to administer the vaccine? Because when you give someone a job, what am I going to get from it? That's the usual question they ask. How are you going to motivate them enough to give up their best so that they can administer the vaccine to the people affected? Thank you very much.
Let me add to your question, and how you're also ensuring that people don't go out there and now start charging 10 cedis per vaccine, 5 cedis per vaccine. So while you're motivating on one front, what are you also doing to ensure that people don't use it for rent seeking? Yes, sir.
Good morning. My name is Salom Gwabiji. I work with the Finder. To Dr. Abuaje, it's not really a question, but more a request. You gave a regional breakdown of school infections, 556 total, and then you gave the regional breakdown. But in the past few weeks, I have sought that information on school-specific breakdown. I have not got that information. I've called your people, but still have not got it. So I was wondering if you could give the media that information regarding school-specific breakdown of infections.
Dr. Kisi, mine is actually not a question. I'm only pleading that our media houses now choose some specific people for medical correspondence. The reason why I'm saying that is, it is one thing hearing, and it's another thing reporting. And where we've gotten to in the world, it is important that our media houses, as part of this information or communicating to our local people, that they assign some people particularly for medical correspondence. Nothing against all our people here, but I think in other parts of the world, the media you'd see at this function will be people who have some biology, who have the basics, and in that way, it makes reporting much palatable for the average Ghanaian. So that is just my small comment for it. Thank you.
Thank you, Honorable Doctor.
Thank you for the opportunity, Honorable Minister. My name is Diana Hobson, and I'm representing the Ghana Psychological Association, lay counselors. I would want to suggest that we use, as a musician as well, I would suggest that we use theater for development in educating the populace concerning this, because the stigma is so much, and I believe that will help. Maybe we could also adapt one particular music so that people will know that when you hear this from this group coming to do the vaccination, they are authentic and legitimate. That would also help. Finally, I saw a post about a Canadian company that has linked up with medical people to bring a kind of COVID technology to Ghana. And I'm not sure, I don't know if you are aware and if you have any info on that for us. I saw it in the press. Thank you.
Thank you. Canadian COVID technology, I don't have any information. If my colleagues here have something, I'm sure they'll be able to speak to it. But let me, on the back of that, throw a question out. Is it true that private individuals and private companies can also import their own COVID vaccines on their own for their staff and for other purposes? I'd like the head of immunization to deal with that. Let me quickly deal with the issue of medical or health correspondence. So part of the stakeholder engagements is to get, through GIBA, particularly the electronic media, to nominate their health correspondents so that working with Ghana Health Service and other agencies, we're able to provide them with some background training, because we concede that we don't have a lot of doctors on our mass media platforms today. We have colleagues who are holding the fort, but who would also like to be further educated on the science of what we are doing. So GIBA will be helping us with the details, and Ghana Health Service will just be coordinating so that we're able to provide them with that one. And Theatre for Development, as well as music, fits into the public education campaigns that we'll be running, and we'll deal with that detail later. Doc, let me start with you, and then I'll go back to wrap up here.
Okay, so thank you, Honorable. Yes,
that's the problem when there are too many doctors up on the stage.
The last bit was about whether people are allowed to bring in vaccines. I think that one falls within the domain of FDA. We are in charge of public vaccines. The other one was about we leaving out persons who man the pharmacies. If you remember, in the group 1, the health workers, they are part of the health workers, because they are also health workers. They are frontline, actually. And anybody with a cough, that's the first point of call, so they are considered within that. Product liability, it's borne by both the government and then for COVAX. In fact, it's a shared responsibility. For COVAX, they've taken it up, those vaccines that we are taking through COVAX. So COVAX has set up some funding for that. And then I know that the government also has taken a portion of it. Those are the last two questions that I have.
I believe there was a question about, I think, vaccines standing the test of time. I think in my presentation, I was referring to the technology. So I was saying that the yellow fever vaccine was discovered in 1938. We're using it still. It doesn't mean the vials have lasted that long. So vaccines will come with a clear expiration date. And they also, as Dr. Chano has said, come with heat-sensitive labels. So if they're exposed to temperatures that are above the required, that will change and mark the vial as not fit for use. So vaccines have a limited shelf life, and so that is all the more reason why once we receive them, they have to be deployed and used in a specified amount of time, so as not to waste them. So to answer your question, vaccines do have a limited shelf life, but I believe the Ghana Health Service and the FDA are fully on top of that, and will be tracking that as the deployment proceeds. So I hope that answers your question. Thank you.
Thank you. My question was on how to avoid corruption during the vaccination and how to motivate. We've had a very long history of using our volunteers and motivating them to do the work. We anticipate that there might be some mad rush for this, and so the corruption may also be people who may also want to push for that. But we'll do that by doing the training and showing them what to do, and also very effective monitoring on the field. And of course, we expect that all of you will be part of the team to assist us to report any such malfeasance. But our history tells us that we might be able to do this without any hindrance. So do training and do monitoring consistently to ensure that this is done. The schools. We don't normally specifically, release the names of schools that are outbreak. Like I said, we have 139 schools that have reported cases with about a total of 5, 6. When we have a case, parents are informed, the education services administration are informed, and then the health sector is informed to respond. And I think let's keep it that way. Thank you.
Doc, thank you. There was a question about whether, in fact, that was my question, whether private organizations can on their own import and, whether for their staff or whatever. I want to go to the FDA boss. Mrs. Darko, is it possible? Is it done? Because I've already started seeing reports online about this company, is assuring its staff that it will buy vaccines and vaccinate them.
Okay, so thank you very much, Honorable Minister. Under emergency use authorization, one of the conditions is that vaccines have to be imported through the Ministry of Health. That allows us to be able to monitor what is coming in and also to monitor where they are going. So I'm sure if any private individual wants to import, they would have to do it through the Ministry of Health. That is one of the clear conditions of an emergency use authorization. Thank you.
Thank you. Doc, you want to add anything to it?
Yes, and the vaccination, because of cold chain issues, GHS will do the vaccination. Even if it's your vaccine, the GHS will have to hold and do the vaccination across the country.
Thank you. Distinguished guests, ladies and gentlemen, it's just hit noon, and so it's time to wrap up. We want to start by saying thank you to the Minister-designate responsible for health, the Director General of the Ghana Health Service, our colleagues from the expanded immunization program, and the West Africa Center for WACBIP. We want to thank you all, as well as our colleagues from the Food and Drugs Authority, Ghana Medical Association, Ghana Registered Nurses and Midwives Association, our colleagues from the media. We're very grateful that you've joined us for this very first public engagement.